My name is Dr. Bob DeMaria, the Drugless Doctor, with another Get to Know Fitness 101. It's the fall injuries. There's fall golf. That's not very popular, but it's definitely out there. Football, soccer, cheerleading, even cross country. Are you concerned? Do you have a plan in case you get injured? Let me give you a few tips right now. If you ever have any type of injury at all, always start with ice. I know it seems really simple, but not more than 10 minutes, and never lay your body on the ice. Always apply ice to the area of injury. You're going to use ice 10 minutes at a time. See what ice does? It takes the blood out of the area. It gets rid of inflammation and tenderness. After a day or two, or when the sharp pain goes away, then you can start adding moist heat. What exactly is moist heat? You're going to get a wet cloth. Oftentimes, just a washcloth will be fine. And then apply a heating pad or a hot water bottle on top of the moist cloth. 20 minutes at the most. You always make sure that you end with moist heat. 20 minutes. Ice for 10, moist heat for 20. Now, let's just stop the pain overall. Do you know a third of you watching me right now have some type of pain every day? So how do you avoid pain? Well, what I have learned from my experience is that oil, the right oil inside of your body, is so imperative to take away pain and inflammation. Do you eat? You can say, Dr. Bob, food has something to do with pain? Yes. If you eat trans fatty acids, that's commonly found in chips and French fries and snack foods, do you know that trans fatty acids can cause pain? So let me give you a little secret. Start taking flax oil every day. Take 1 tablespoon of flax oil per 100 pounds, regardless of the age, regardless of the sport that you're in, whether you be male or female, young or old, weekend warrior or not. By adding flax oil alone, you're going to create a hormone in your body called a prostaglandin. Prostaglandins help relieve pain. So you could have fall injuries that can be minimized. Something else that I do with our patients on a regular basis is that we'll use a digestive enzyme. A digestive enzyme takes away inflammation inside of the body. You may say, well, Dr. Bob, what kind of digestive enzymes, what type of digestive enzymes should I use? Well, you go to your health food store and just ask them for an enzyme. Or, of course, you could go to our website. We have a product that we use called Hydrazide. Hydrazide and Intenzyme Forte. That's Hydrazide or Intenzyme Forte, helps take away inflammation in the body, because most fall injuries, pain and inflammation, are due to the fact that you have inflammation already inherent in your tissues. So that's really significant. One other thought, any time of the year, but especially in the fall, because the temperatures are changing, be aware of how much dairy products that you're putting in your body. So, well, Dr. Bob, what does dairy have to do with pain? See, if you have an injury, dairy products themselves have a type of fat called arachidonic acid that can cause pain in your body. So if you're a football player or a soccer player, or you're running cross country and you're consuming a lot of dairy products and you have pain and inflammation in all the joints inside of your body, just cut back. Just for a month during the fall, minimize dairy products. Use coconut milk or almond milk or rice milk as an alternative if you're going to be using them on any type of your breakfast cereals, because the dairy, the cow's milk, can actually cause pain. Here's just a couple other thoughts for you. Let's just say that you have a sprained ankle or a sprained knee, and you decide you're going to use some type of an elastic wrap. What we have found from our experience, especially in the lower part of the body, you always put the wrap and go upwards. That means if it's on your ankle, you go upward up to the mid-calf region. If you have a pain in your calf or in your knee, you always take the ACE bandage or the elastic wrap up, because what's going to happen, you're going to impair or impede blood flow, and you're going to have swelling, and we don't want that to happen. Now, to prevent injuries, you want to make sure that you stretch. And what I encourage you to do, and it might be really simple, is just do some knee bends. Just bend over it, touch your toes, lie on your back, put your hand underneath your thigh and raise your leg up towards your chest. You want flexibility. In my experience, one of the leading causes of low back and hip pain is not stretching enough. So let me wrap all this together for you, okay? Drink water. Water is going to help take away and prevent pain and inflammation. Think about a digestive enzyme. Make sure you have a flexible ice pack at home. Make sure you have either a hot water bottle or a heating pad that you can use, especially if you're a high school student or a college student. You might not think about having those items at home. Moist heat brings blood into the area. Blood promotes healing, and it's all about promoting healing in the area. And one last thought. Vitamin C. Vitamin C is very significant for restoration of connective tissues. Eat red, yellow, or orange bell peppers. They are an excellent source of vitamin C. And eggs, onion, and garlic will also add sulfur to your body, and sulfur is really important for connective tissue strength. So by just adding these few little tidbits to your regular routine, you can help prevent injuries. Make sure you stretch. Make sure that you consume a different source of product besides the dairy product, because your body's going to have an inherent state of inflammation constantly, and we don't want that to occur. Always make sure that you ice after an injury, and if you do that, I promise you that your body will function optimally, and you're going to minimize and you're going to speed up the healing process. I'm Dr. Bob DeMaria, the Drugless Doctor.